With the help of our videos, we'll give you a practical and understandable overview into aesthetic treatment using hyaluronic acid. By the end of this lecture series, you'll be acquainted with the legal aspects of hyaluronic acid administration, as well as the necessary steps for patient preparation, documentation, and follow-up. In addition to the above, you'll learn about the materials and injection techniques necessary for safe and effective treatment. With the help of video demonstrations, we'll guide you through injection treatments of the lips and perioral area, the tear trough, and the cheeks. Equally as important, we'll provide you with detailed instructions on managing possible complications and administering hyaluronidase. With our basic course, we offer 4 step-by-step video lectures that cover all the important bases regarding hyaluronic acid treatment of the lips and perioral area, the tear trough, and cheeks. In this video lesson, we cover the various indications for hyaluronic acid treatment, the assessment of skin folds and wrinkles, and the important aspects of obtaining patient consent for the procedure. We'll also cover the absolute contraindications. Let's get started. Each and every aesthetic injection of hyaluronic acid begins with a patient's request. When obtaining the patient history, it's important to also find out what exactly the patient wishes to achieve with treatment and consider the chances of success with this particular therapy. You should explain in detail the changes that the patient can expect to see after treatment. There are some important points to consider here. For example, a reduction in wrinkle size or depth around the eyes or the nasolabial fold can lead to profound changes in a patient's appearance. Some patients have reported that their friends, family, and sometimes the patients themselves perceived the post-treatment changes in appearance as too strong, leading to the patient abandoning further hyaluronic acid treatment. As in all patient interactions, it is important to not only be honest regarding the potential outcomes, but also to guide the patient's expectations in a reasonable and realistic manner. In this lesson, we'll cover the proper documentation of that interaction. In addition, we'll discuss the correct preparation and follow-up to injection treatment. After confirming that hyaluronic acid therapy is indicated and obtaining patient consent, detailed documentation is the next step. This step consists of both written and photographic documentation. The photo documentation should always be performed both prior to as well as after treatment. It is important to consider the quality and dimensions of the photos. Not only is a camera-to-face distance of 15 to 20 centimeters optimal, but also make sure you are using proper lighting and that the patient's face is free of makeup. Photographs should be taken of the face in both a relaxed state without muscle contraction, as well as an active state, such as actively smiling. The latter is important as activities such as smiling can cause some parts of the face to be pulled upwards. Being cognizant of this fact can prevent overcorrection from treatment. In this lesson, we'll show you the variety of hyaluronic acid preparations and their properties, as well as the features of different kinds of needles. We'll discuss the differences between bevel types and when each type comes into use. First, we'd like to objectively define the term filler, which is commonly used when discussing hyaluronic acid therapy. Fillers are substances that, as the name implies, can fill a tissue defect. As such, this term is very broad, and hyaluronic acid is just one of the substances that falls into this category. One differentiates between absorbable, long-lasting, and permanent fillers. Examples of absorbable fillers are hyaluronic acid, collagen preparations, and fatty tissue autografts. Long-lasting fillers include poly-L-lactate microspheres or calcium hydroxyapatite microspheres. Permanent fillers remain in the tissue to which they have been applied and are not absorbed or eliminated by the body. 2 examples of such fillers include polyacrylamide and PMMA. Now, let's deepen our understanding of hyaluronic acid. In this lesson, we'll cover the most commonly used injection techniques so that you'll feel comfortable with the procedural aspect of hyaluronic acid injection. By the end of this lesson, you'll understand when and why to use each technique. We'll cover the following 3 methods: the linear technique, the point technique, and the fanning technique. Let's begin with the linear method, also known as the tunnel method. which is best used for superficial, narrow, and linear wrinkles. This is one of the basic methods for injection and should be used primarily with low viscosity hyaluronic acid. In this lesson, we'll go over the injection of hyaluronic acid in the area of the lips and show some basic approaches for an aesthetic result. The red aspect of the lips, also known as the vermilion, has an extremely thin layer of epithelial cells and little to no melanocytes. For this reason, the lips are particularly sensitive to ultraviolet damage and are more susceptible to the sun's aging effects. In addition, the skin of the lips is free of sweat and sebum glands, with the resulting lack of a hydrolipid film causing the lips to dry out faster. In this lesson, we'll go over the aesthetic treatment of the area around the mouth, also known as the perioral region. Due to the effects of ultraviolet rays on this particularly exposed area of skin, individuals tend to develop small, radial wrinkles as they age. Perioral wrinkles are arranged in a radial pattern around the lips, similar to that of spokes around the hub of a bicycle wheel. They commonly occur due to atrophy of the supramucosal soft tissue and increased activity of the orbicularis oris muscle. Other important factors are frequent ultraviolet light exposure and smoking. Begin with a thorough disinfection of the perioral region. This lesson will cover the treatment of the tear trough, also known as the infraorbital space. In addition, we'll show you how to smoothen small creases found within this area to achieve a balanced and natural appearing result. Causes of a markedly visible tear trough are varied. They range from ethnic predisposition, age-related, stress and fatigue, and some external causes such as smoking or strong ultraviolet light exposure. Prior to initiating treatment, it is important to know which of the mentioned causes is responsible for the patient's findings. In this lesson, the last of the injection techniques, we'll discuss the treatment and injection of the buccal region, also known as the cheek. The goal is to achieve a harmonious and balanced appearance of the midfacial region. The windmill technique is a deep horizontal augmentation technique which makes use of just one injection point to harmonize the middle of the face. Once again, we present a schematic overview of the fatty chambers of the face in a young woman. As we age, the initial facial changes are due to atrophy of the subcutaneous fat pad, followed by a progressive loss of volume of the bones of the face. As a result, the face begins to sag and lose its natural convex shape. This is the final lesson of the course. In it, we'll cover a very important aspect of hyaluronic acid treatment, the complications. At the end of this lesson, not only will you know the most common complications, but you'll also be able to effectively avoid and, if necessary, treat them. The most common complications include infections, hematomas, asymmetry, a blue discoloration of the skin known as the Tyndall effect, allergic reactions, and bumps or blemishes. Here, we present an overview of the most important danger zones, as seen from the lateral view. Now we'll delve into the use of hyaluronidase. Hyaluronidase is an enzyme that dissolves hyaluronic acid. In Germany, a product called Hyalase Desal is available to use. Be warned, however, this product can only be used off-label.